Thank you for joining us today for our weekly COVID briefing. Today, we're joined by Monroe County Public Health Commissioner, Dr. Michael Mendoza, Dr. Stephen Schultz, a pediatrician with Rochester Regional Health, and Dr. Stephen Cook, a pediatrician with the University of Rochester Medical Center. Today, we are reporting 337 new COVID cases with a 7-day average of 253. Last week, we reported 224 new cases and a 7-day average of 191. Later on, we'll let Dr. Mendoza discuss a little bit of what we're seeing in the uptake in uptick in cases that we've seen over the last week. But I can tell you this increase underscores the importance of getting vaccinated. Thanksgiving is just 3 weeks away. Vaccination is the best way to celebrate the day with friends and family safely. Last year, we saw a surge in cases over the holidays. We now have a proven way to keep our family gatherings safe. Please take the vaccine. Let's get into pediatric vaccine availability and locations. I understand parents are anxious for details. I know this because I am a father of a 10-year-old and have the same questions. That is why Monroe County is now providing additional pediatric clinics to support efforts to vaccinate our children against COVID-19. Our healthcare systems, pediatrician offices, and some pharmacies are all offering CDC-approved Pfizer vaccine for 5 to 11-year-olds. The doctors joining us today can discuss what Strong and Rochester Regional Health are offering and planning for pediatric vaccinations. However, we know the demand is great. This is a priority for my administration. Monroe County is working to get more children vaccinated by providing additional clinics. Therefore, today I'm announcing that Monroe County is operating 4 COVID-19 vaccination clinics for children ages 5 to 11 on Saturdays and Sundays beginning this Saturday, November 6th in Greece, Pittsford, and Rochester. These clinics will continue until community demand for pediatric vaccination is met. Appointment-only pediatric clinics will run from 9 a.m. to 3 p.m. Saturday, November 6th at Pittsford Plaza, located at 3349 Monroe Avenue. The mall at Grease Ridge, located at 112 Grease Ridge Center Drive, and at Monroe Community College downtown campus at 321 State Street and Maury Silver Way. The 4 clinics will not be administering vaccine to those 12 and over on those days of pediatric vaccinations as a safety measure to avoid mixing different doses. Appointments are also available along with a limited number of walk-in slots available for youth ages 5 to 11 from 1 p.m. to 4 p.m. Sunday, November 7th at the Edgerton Rec Center located at 41 Bacchus Street. All minors must be accompanied by a parent or guardian, and appointments can be booked via monroecounty.gov. Since the start of this pandemic, I have been focused on keeping our schools open and our children in the classroom. It is so important for them and for all of us. It's why the county funded and distributed rapid PCR test machines in schools and why we operate a drive-through rapid test site. We need to do everything possible to have our children in school and not have to be home for a week in quarantine. Having your child vaccinated is the best way to protect them and to protect your family. And it's the best way to keep our kids in the classroom. These county-run pediatric vaccine clinics provide one more option for parents who want to access the vaccine but aren't able to see their pediatrician quickly enough, or for parents whose children don't have a pediatrician. Vaccination is safe, effective, and free. It's the most important tool we have to end the COVID-19 pandemic, and vaccinating younger children will help slow the spread of this disease and bring us closer to returning to a sense of normalcy. We will have more information on all of the pediatric vaccine sites available on our website at monroecounty.gov. Monroe County is also seeking additional vaccinators to assist with the pediatric vaccination efforts. We're taking applications for pediatric vaccinator positions. They are temporary positions that pay more than $28 an hour. If you're a registered pharmacist, medical doctor, nurse practitioner, physician's assistant, registered nurse or licensed practical nurse, or if you're certified as an advanced emergency medical technician or paramedic, it's a perfect part-time position that will provide a vital service to our community. If we're able to hire additional vaccinators, we'll be able to expand our capacity immediately. So if you qualify, we would love to have you as part of our team. Applications and details available at monroecounty.gov. And now here's an update on our vaccination efforts, vaccine incentives, and rapid PCR testing. To date, Monroe County has delivered more than 510,000 doses of COVID-19 vaccine. As you know, Monroe County offers a $100 incentive to people who get the full COVID vaccine. series in clinics where we have lower vaccination rates. For Pfizer and Moderna vaccines, those receiving their first dose will get a $50 gift card and receive another $50 card for their second dose. Those receiving the single dose of Johnson & Johnson vaccine receive a $100 gift card. The incentive eligible sites include our county fleet center on Paul Road. This incentive offer only runs until November 23rd or until the money runs out. You can find participating vaccine clinics by visiting the Finger Lakes Vaccine Hub website or by calling 211. 3 weeks ago, we announced a new drive-through pediatric rapid PCR testing site at the Fleet Center for local K-12 students. As of today, we've performed nearly 600 tests at this site with only 26 positive results. That means more than 550 children were able to go back to school the following day and not have to wait up to a week to return to the classroom. Again, these rapid PCR tests get results in hours, not days. The Fleet Center can now handle up to 70 appointments per day. On our rapid PCR program for in-school testing, Monroe County distributed 126 rapid test machines to 28 districts and private schools, along with 10,000 testing cartridges. The county is providing PCR rapid test training for schools, and we are expecting another shipment of 100 rapid test machines in the near future. And now here's Monroe County Health Director, Dr. Michael Mendoza.
Good afternoon. Thank you, County Executive Bello, and thank you to my colleagues, Dr. Stephen Cook and Dr. Steve Schultz, for being here today. And as always, thank you to the members of the media who are here to join us as well. We are once again at a major turning point in this pandemic. County Executive Bello has outlined our plan to begin distributing the COVID-19 vaccine to children's ages 5 to 11. I want to underscore a few important points for parents in our community. More than 11 million children and teens aged 12 to 17 have already received the COVID-19 vaccine. 11 million shots have been administered to young people, and adverse effects have been extremely rare. The dose for children aged 5 to 11 is 1/3 of the dose given to older children, adolescents, and adults. It is appropriate, it is safe, and it is effective, and it is far better than getting COVID-19. We know that most of the time, COVID-19 cases among children are mild. And we also know that COVID-19 has become one of the top 10 causes of pediatric death in our country. In September, it was ranked number 6 for children ages 5 to 14 by the Peterson-Kaiser Family Foundation Health System Tracker. Tens of thousands of children and teens have been hospitalized with COVID-19, and we know that not all children are safe from serious complications. I also want to address the concern over one of these complications, myocarditis. Myocarditis is a rare condition associated with the vaccine in children, but we also know that myocarditis is possible in COVID-19 itself, and the odds of getting myocarditis after being infected with COVID-19 are actually higher than the odds of developing myocarditis after the vaccine. Thankfully, most patients diagnosed with myocarditis after the vaccine feel better and can usually return to normal activities quickly. We do not yet have that same level of reassurance for myocarditis following COVID infection, unfortunately. I know Dr. Cook and Dr. Schultz will have a lot more to share on this, but please, I urge parents who are unsure about whether to vaccinate their children to gather as much accurate information as you can and talk about this important decision with your own family doctor or pediatrician as well. Turning gears just a little, I want to update you all on the test to stay option being considered by the Monroe County Department of Public Health. We understand that there is significant interest among many schools in our community for an option that would allow unvaccinated students who are exposed to COVID-19 to continue with in-person instruction as long as they feel well and test negative for the virus. We also know that vaccination status, masking, social distancing, and other protective measures are closely monitored in schools, making it far more difficult for the COVID-19 virus to spread compared to most other viruses in the school. At this point, my team and I have reviewed the science and feel that test to stay is a reasonable approach as long as the substantial concerns around equity and logistics can be resolved. We are in the process of working through those details, and I anticipate being able to recommend a test to stay option once we have finalized all of these conversations with the schools and for schools to finalize those conversations with their parents. I realize that test to stay can feel like a huge relief, and it is, especially for the families who are impacted. But I also want to remind you, especially now that vaccines will soon be available for basically all school-age children, that asymptomatic close contacts will not need to test to stay if they are vaccinated. Vaccinated students won't have to test to stay, they simply get to stay. That said, I urge schools and families to remain patient. We are working hard behind the scenes to make test to stay a safe and effective reality. And with that, I want to turn it over to my colleagues, Dr. Cook and Dr. Schultz.
Good afternoon. I want to thank everyone for joining us today, and just very excited about being able to roll out this vaccine. I know everyone is anticipating this and is trying to get their hands on this because it is something that we've been looking forward to for a long time. The pediatric and family medicine practices within the U of R network and accountable health partners, including our colleagues in community and primary care practices who care for children, are preparing to offer the vaccine to parents either at clinics conducted at their own locations or via dedicated scheduling at centralized locations hosted by the county. A number of these practices have already started vaccinations this week, and most sites will be fully ready to vaccinate by November 15th. The families are encouraged to look to their communications to their primary care provider. Checking MyChart is one example as a way to find these appointments. Talking with the office staff as well as looking at the webpage can also provide insights as to what their scheduling procedures are. At this time, we are very excited that we've been able to collaborate with the county as well as the other practices under WROC or regional to get as much of the vaccine out as possible. It was a little confusing at the beginning in terms of when it would actually arrive, but we know it's starting to arrive at many of the practices in our community, as well as many of the commercial pharmacies in our area that are also offering vaccinations to children in this age group. Steve?
Thank you, Steve. I appreciate everybody being here as well and having this opportunity to speak about this really momentous occasion. This is the next step, and we're really looking forward to helping kids stay safe and stay in school. As a reminder, we're not only protecting our children, we're also protecting their classmates, we're protecting the teachers, we're protecting the coaches and the staff at schools. We're also protecting our family members as everyone embarks on the holiday season coming up. And those are all extremely important reasons why it's great to get your child vaccinated as soon as they can. At Rochester Regional, we've also been working hard to prepare for this rollout. We have a 50 family practice and pediatric clinics that will be live and offering the vaccine the week of November 15th, with a handful of practices that will be going live next week as pilots. You can expect our website to be updated for Rochester Regional Health with new information. And you can also expect that we will be reaching out to you through MyCare and other messaging in order to let you know when your clinic is live and ready to go with vaccines and clinics. Thank you.
Okay, we're going to start the question round. Before we do, I just want to let everyone know the county executive and the doctors are on tight time schedules today, so we're going to limit this to on-topic questions. If you have any off-topic questions, just contact County Communications or myself right after this briefing, and we'll try to take care of you then. So we are going to start. We have Jennifer Lukey from WHEC up first.
Good afternoon, gentlemen. Nice to see you all. Dr. Mendoza, it seems to me, and I think most people, that there are two groups of parents. Parents who are very excited about this and parents who are very not excited about this. And it's a yes or it's an absolutely not. And I'm wondering how you reconcile this with parents who see that even vaccinated adults are continuing to get COVID. And yes, they're staying out of the hospital, but they're still getting it. And the vaccine effectiveness, I think, according to the state, is somewhere between 75 and 80%. So how do you convince parents who are absolutely not or leaning no or saying, hey, I'm going to wait a while and see how this goes?
Well, I guess I'd first start by saying that there are a lot of people that are really in the middle. I think parents are looking at this feeling in many cases like there's a lot of information coming at them at what feels like a very short period of time. I would say that most people are probably somewhere in the middle. Even parents who themselves are fully vaccinated and have gotten their boosters, I think have every right to say, well, I want to make sure that this is the right thing for my child. So I'm not treating anybody as a definite yes or no. I think most people are really in this to do the right thing for their kids, and getting that information as best as they can, I think is critical of that. We know that the vaccine is highly effective, but nobody's ever going to tell anybody that it's perfect. We know that people who get the vaccine are far less likely to succumb to hospitalization or worse. We are looking primarily at trying to keep these kids safe, but we also know that keeping our kids safe does have an indirect effect on their family members as well. We know that these breakthrough cases are possible. There are a whole host of things that we can't predict, but what we do know is that people who get the vaccine are far better off than those who do not. And the truth is really plain and simple in that way. So get your questions asked, get your questions answered, and be sure you get your information from valid and credible sources. With every turn of this pandemic, there have been an emergence of new questionable sources of information. Your best source of information is going to be your primary care doctor, your pediatrician, family medicine physician, or us here in the health department. But we want to make sure that all parents know that it's okay to ask questions and that there's a lot coming at us all at once.
And I guess for my follow-up, I'll ask, I hear you all loud and clear, all the pediatricians saying, have a conversation with your own doctor about it. Are there certain groups of children who you will say, no, not yet?
So I would say that the only children that we say no, not yet are those that aren't approved under the EUA. So children under the age of 5. So children 5 and older, we saw a very, very good response in terms of the effectiveness of the vaccine. They actually tested 3 doses at the beginning, the 30 microgram, which is the adult dose, 20, and then 10. And they chose the 10 because of less side effects and an equivalent response in terms of the antibody response. They even added additional subjects to the study, another 2,000 subjects, I believe, to track early on to look at additional cases of myocarditis as a concern. And in this young age group of 5 to 11-year-olds, they didn't see any, which is very reassuring. Now, of course, that's not what the reality will be. There will be some cases of this, but as we've seen, the cases that present with vaccine-related myocarditis are far less serious, far less severe, and recover to a much greater degree and much quicker than we see with children who get myocarditis either from multi-inflammatory syndrome or from primary COVID infection itself. So there really are no contraindications. If there are very specific allergy type of questions, people who have allergists, immunologists, talking to them is worthwhile, but there's nothing in our contraindications right now as a reason not to get the vaccine.
Okay, our next question comes from Natalie Kuchko from 13 WHAM.
Good afternoon, everybody. This question's for Dr. Mendoza. I want to focus on the latest spike in cases. Now, we've seen a couple of days breaching over the 300 figure on a daily average. And I want to ask, can this be linked to the PCR testing? And off of that, are you seeing that when families get tested or kids get tested, it expands to the whole family? If you could explain that for us.
Sure. Well, you heard the statistics earlier from the county executive that of all of the PCR testing that we've done, at least in the county, we're really not seeing very many cases of COVID. Most of the COVID that we are now seeing in this sort of 300 plus range has been more of the same thing: indoor gatherings, workplaces, household transmission, whether it's through social gatherings that people are having with friends and loved ones in their home, or between family members. The story that we get often is that one member of the family will test positive, and because of how difficult it is to quarantine at home, and nobody's really wearing masks in the home, it's very easy for one member of the family to transmit it to the rest of their family. So we see this in the case reports. One individual with the family, and then a day or two later, the rest of the family turns up positive. It is a function of us being indoors more. The months are turning colder. We're not going to be outdoors as much as we are. And even for vaccinated individuals, the booster is at 6 months for a reason. We're recommending the booster for really anybody who's at risk at 6 months, because that is where we're seeing some of that immunity begin to wane. And here we are at the beginning of November, 6 months ago, was when we had administered the vast majority of vaccines in our community. And so what we may be seeing, and we're going to be following this very closely, is what is that breakthrough rate? It has been hovering around 24-25%, but we anticipate that if the cases are attributable to breakthrough COVID from vaccinated individuals, that percentage may increase over the coming weeks. But right now we know that getting your vaccine is the primary defense. Wearing your mask indoors whenever it's practical, certainly important. And be thoughtful about who you're gathering with. You know, the smaller the gathering, the safer. If you can ensure that more people in your gathering are vaccinated, that will be safer. There's no 100% way to reduce risk, but I do think that there are common sense approaches that we can all consider.
Thanks for that. And I just have a quick follow-up with the announcement of the countywide clinics. That's Greece, Pittsford, and Rochester. Are we able to define, you know, the streamline of this process, how it will work, what families can expect? Will these be operating similar to the mass vaccination sites that we've seen in the past, or different?
Sure. It operates in a similar way, but it's geared more towards younger children. So the staff that's working at each one of those sites are staff that are used to working with children in that age group, so that it would be a lot more welcoming and a lot more familiar to children who are ages 5 to 11. And so that's why I don't want to refer to them as mass vaccination sites. These are smaller, they are smaller in nature. And like I said, it's a different a group of staff that's working at these clinics. What to expect, though, is very similar in terms of the process. Go right to our website, monroecounty.gov. You can find the appointments that are available there. It's free. And we're also taking walk-ins at the Edgerton Clinic on Sunday. The other clinics are by appointment only. That's the other difference, to make sure that we have enough vaccine to meet the demand and with a limited number of vaccinators that we have. But other than that, the guardian, a parent or guardian, needs to be with the child when they come in order to have be able to consent to the child receiving the vaccination.
Thank you.
You're welcome.
Thank you, Natalie. Do we have a reporter on from WROC? Okay, we're going to move on then. Looks like we have Wendy Wright from Spectrum. You're on mute, Wendy.
Wendy, you might be on mute.
Why don't we let Wendy work that out, and we'll go on to Sean Lehman, and we'll come back to you next, Wendy. Sean Lehman from the DNC.
I'd like to ask Dr. Mendoza, how well have we done so far on getting teens vaccinated? Are you pleased with the progress we've made?
Thanks for your question, Sean. What I would refer you to is flvaccinehub.org. There you'll see the vaccine rates for the age groups that you're describing. I think in general, when we're looking at school-age children, most of our schools are doing very, very well, with percentages in the 70+ range for eligible students. Our city is doing very well now. In recent weeks, so we've seen some great improvements in the city as well. But all those data are available at flvaccinehub.org. I will say that with the addition of 5 to 11-year-olds, this is going to hopefully increase the rates of the teenagers now that we'll have more people coming in. And so I'm very hopeful. I think our schools have worked together very well to educate their families about the vaccine. And I think the results are starting to pay off.
And all three of you, all four of you, I guess, have said this is a momentous mark that we've reached. Does this begin to make you feel hopeful that perhaps the end is in sight for this pandemic?
Well, if I had $1 for every time I thought this pandemic was in sight, I'd be a much richer man. The reality is that we've just got to keep on going. This is a very important occasion, now having another significant portion of our population now eligible for the shot. Our hope is that not only do we in this community bring up our vaccine rate, but the rest of the region and state and country do as well. The question as to whether there will be another surge, another variant, those are all open questions. But I do know that as quickly and as effectively as possible, if we can get the majority of our population vaccinated, we stand a much greater chance to beat back any future variants and surges, and hopefully see an end to this pandemic.
All right, thank you very much.
Thanks, Sean. Okay, Wendy, you're up again.
All right, I'm hoping you can hear me. Sorry about that. I'm I'm using a computer I haven't used before, so thank you for your patience. I was wondering about the actual percentage, if you have that, Dr. Mendoza, of children in that age range 5 to 11 that have actually contracted COVID or who are at high risk of getting extremely sick or dying.
So I don't have the exact number, but we do have that on our dashboard. For school-age children, the proportion, I will say, of our new cases in that age group has been declining over recent weeks, which is good. But beyond that, I don't have those figures off the top of my head. I think either Dr. Schultz or Dr. Cook might have additional insight on that, though.
No. Okay. Well, so what I wanted to also ask about was, people have been told, let's, talk to your individual pediatrician. Even adults have, talk to your individual doctor, that type of thing. But are all pediatricians on the same page on this? I'm hearing sometimes not so. Is there something that's sort of a universal message that all pediatricians are supposed to put out there to their patients?
As far as I'm aware, all pediatricians are recommending the vaccine for their families that they care for. We know that this is a safe and effective vaccine, and it's the best way to protect the children and families that we care for. I think that message is pretty consistent. I think it's probably difficult for every pediatrician to respond to every question out there. We are still very busy seeing kids for well checks, for illness visits, to get them back to school, on top of now rolling out the vaccine and those sorts of things. But I know that I'm talking with my families regularly in the clinic and encouraging them to do it. And, we're looking forward to being able to offer this vaccine to our children in our clinics.
Yeah, Wendy, I would add, I can't speak for every pediatrician. I don't think any of us can. I do think that the American Academy of Pediatrics, along with the American Academy of Family Physicians, have been very consistent in terms of, areas our members see and strategies we want to take in order to kind of end this pandemic as quick as possible. And while I don't know exactly how many pediatricians or who exactly is in favor of it, what we're seeing, either with redistribution from the county or direct orders from practices, is the vast majority of pediatric practices and reasonably sized family medicine practices, some being smaller, may not have many kids there, are requesting vaccine. So they are trying to get it into their office. The whole process has changed. It's easier to ship to a practice and to have it stored in a regular practice at smaller volumes. And this is a very different setting than we were 6 months ago, where there was only mass vaccination sites and there's lots of constraints on the use of it. So I don't know if every pediatrician is 100% on board. I can't say that, but I do see a lot of practices that have ordered vaccine to give to their families.
Okay, thank you. I do have some off topics, so we can email later. I appreciate everybody's time today. But we have been trying to
move on. Next up is, and our final question today is Raquel Stephen from WXXI.
Hello, gentlemen. Dr. Schultz, I had the opportunity to meet with you yesterday at your presser. And in that presser, you said that some pediatrician doctor's offices may receive the vaccine a little later, depending on staffing. Some may have staffing issues. Is this still the case, and how true is that?
So, everybody is receiving the vaccine regardless. I would say that all of our clinics, I think throughout the region, are feeling the pinch with staffing. And that's been a difficult thing to continue to see patients in the office for, like I mentioned before, all of our physicals that we're doing, plus all the return to school testing and evaluations of sick kids that in many years in the past wouldn't have even shown up on our doorstep, because it would have just been written off as, a virus, and the parents wouldn't have bothered to come in unless maybe there were fevers or things like that coming on. So, our demand is a lot greater now than it ever has been. And it's kind of a perfect storm of the physical demand still rolling in as well as the illness visits in combination with, some of us losing staffing in respect to mandates and those kind of things. So while the vaccine is going to be available, different individual clinics may have different availability in when they're able to offer it and how frequently. And so, some clinics will probably be, a lot of clinics will probably be doing the after hours, Saturday morning sorts of things when we don't have other kids, coming through. But that's going to vary clinic by clinic and throughout the systems and private clinics as well, I'm sure.
Thank you. And my other question would be the uptick in COVID cases. Does that include the at-home testing as well? Are we including those numbers in our COVID numbers?
So the at-home tests are very difficult to track because it relies on the person who's conducting the at-home test to report them. We feel pretty confident that we're getting the positive results. So the positive cases that we're reporting, we do believe we're getting the vast majority of those. But as far as the negatives go, I don't think that we're getting all of the negative results. So what that would do is maybe leading to an artificially high positivity rate. But I do think that the vast majority of the positives we are becoming aware of one way or the other here in the health department.
Okay, thank you. That does it for questions. Thank you for respecting the time of these officials today, and have a good one, everyone.
Great. Thanks so much, everybody. Have a good day.
Thank you. Have a
Good
good
day.
day.